Welcome back, everyone, to Dr. Christy Cares. I'm Dr. Christy Matusiak, and today, instead of being in my office, I'm coming to you from my backyard. So today I want to talk with you about some of the differences between the different types of medicine that are available to us. So there's Western medicine approaches, there's alternative medicine approaches, and there are holistic medicine approaches. So let's start with Western medicine. Western medicine is where medical doctors, typically some osteopathic physicians, they provide you medications to deal with the symptoms that you may come in with with regard to any particular illness or symptom that you may have. So let's say, for sake of argument, let's just take a simple topic such as cholesterol, right? We talked about this a few weeks back. So if you go into a medical doctor's office and you have high cholesterol, they'll look at your blood work and they'll say you have high cholesterol. We will prescribe you a statin drug, typically, to control your cholesterol from being too high. Great. That is their approach to handling that issue or that symptom. You go to an alternative medicine practitioner, that approach tends to come from a perspective of, okay, instead of the statin, what can we give you to do the exact same thing that's not a medication? So frequently, red yeast rice is an herbal concoction that has the same effect as a statin, but with a little bit less of the side effects. So alternative practitioners typically provide herbs or other supplementation to provide the same impact to control the symptoms as medical doctors do, but they just do it with different types of products. Holistic care practitioners, like myself, we take a slightly different approach in the sense that I want to know why you have high cholesterol in the first place. Like we talked about in that cholesterol video, there's so many potential reasons that you could have high cholesterol. You might just be going through a stressful time. So your body is upregulating that stress hormone and that cholesterol production so that you can channel it down to make more stress hormones or make more sex hormones, whatever you may need at that time. Or it could be diet related, or it could be this or that, or 17,000 other things, right? And so Western medicine is more driven towards acute crisis management. There is a place for every kind of medicine that there is available to us. And I don't like to say that one type of medicine is better than the other. We all have our strengths and weaknesses. If I'm having a heart attack or if I get into a car accident and my spleen ends up outside my body, please take me to the hospital. Do not take me to an office of my own. Take me to the hospital. Acute crisis management is what Western medicine excels at. Alternative medicine tends to be a good bridge frequently between holistic and Western medicine approach, in that sense that we can do a lot of things with herbs and vitamins and supplements without the toxic side effects that often medications provide. At the same time, they don't tend to look at the deeper root cause of those things. And that's where I believe holistic medicine shines. Holistic medicine is for those individuals who are having chronic conditions, chronic issues that come up over and over and over again. You've quote unquote tried everything. You've tried all the supplements. I have patients who come into my office all the time that say, I tried vitamin E for this, I tried this herb. They come in with a shopping bag full of stuff and they say, I've tried everything and I don't know why I'm not healing and getting better. I've tried all these medications. What now? Those are some of my favorite patients to work with because we know we've quote unquote ruled out everything that could be big and scary. Western medicine has taken care of all of that for us. They've tried some basic things. And so now what we're left with is, why is it there? So where I come from in the holistic sense, we look so deeply at emotional, spiritual, mental, emotional causes of these physical manifestations of illness. What you might need is just to get outside and get into nature and enjoy life a bit more. There's so many things nitty gritty. If we go back and through your history, we ask you questions like, tell me about your mother's pregnancy with you, or what was life like growing up with you, or tell me about high school, tell me about your friends growing up, what was your favorite subject in school? We get information about you as a human being, and the disease or those symptoms don't own you. You just happen to be expressing and manifesting those conditions at this particular time. And my goal is to always just find out the why. So if we ask the question, why do you have this? And we can find that answer and correct that at its root cause, you're going to end up with a much different solution than just something that just comes in a bottle. So that is what I want to describe to you. I love having this conversation. If you've got any questions about this, please just comment below, ask. If you like this content, please subscribe, share with your friends and family so that people understand truly what holistic medicine is all about and how it can help and benefit you. So next week, we're actually going to talk about some foods that mimic disease. And so there's certain things that if we eat them on a regular basis, we may not know it, but it's causing dis-ease in our bodies, and it can mimic actually problems that are diagnosable by nature. So we'll talk about that next week. So Until next time, Dr. Christy Matusiak here with Dr. Christy Cares, wishing you a fantastic day and a healthy life.